I'm Brandon. I'm an alcoholic and addict in recovery. Yesterday I talked about using the word recurrence instead of relapse to describe an addict who has gone back to using drugs or alcohol. And I'm going to try to stick to that. You might hear me use the word relapse every now and then, especially since the book I'm reading from right now is called Staying Sober, A Guide to Relapse Prevention. But I do like the idea of using the term recurrence. It's probably more accurate in describing what's actually happening and carries less of a stigma than use of the term relapse, which can sometimes decrease the helpfulness of using such a term. So today I'm talking about recurrence planning, and that is planning to not have one, and what you need to do in order to really make sure that your recovery program has you on track to notice the signs that you might be heading toward a recurrence or a relapse. And so in the book, again, we're looking at Staying Sober, A Guide to Relapse Prevention by Gorski and Miller. They talk about the different steps that you can take to plan for recurrence prevention, what you can do to really plan for this. And so the steps of prevention look a lot like what I went through as part of my treatment for addiction and depression. And so I'm going to go through these and talk a little bit about my experience with similar types of steps in my treatment. And so the first step is stabilization, getting back onto solid ground. So the way they define this is before you can do any kind of recurrence prevention planning, you must be in control of yourself. Stabilization means the process of regaining control of your thoughts, emotions, memory, judgment, and behavior. And so this is, I feel like, what was being done, especially in the first week or two that I entered into treatment for addiction and depression. I was getting stabilized, getting to a point where my emotions were a little bit more in control, and where I could even, when I first came in, I couldn't even hear the messages that were coming across. So this was getting stable, getting back on solid footing, and then going to the next step, which is assessment. So assessment, the second step of recurrence prevention planning, is to discover what caused a recurrence, or in the case of overall treatment, what caused you to get to the point where you needed treatment in the first place. This is done by reviewing your history of addictive using, as well as specific warning signs and symptoms that occurred during each period of attempted abstinence. So really taking a look back and figuring out what made you tick during your addiction or during a recurrence of that addiction. What was going on, what was happening, and why did that seem like the option that made the most sense to you at the time, and kind of assessing what's happening, what occurred during that time, so that you can use that information for some of the next steps. Now, the next step I feel is incredibly important, and it's education. Education was probably the most critical component of the outpatient care I received. So the care that I received after I was in residential treatment for alcoholism and addiction was a partial hospitalization program where I went to treatment from 9 till about 2:30 or 3 every day for about 2 weeks. And then for 6 weeks after that, 3 days a week, 3 hours each of those days, I went to an intensive outpatient program. And in these programs, we really tackled the education aspect of treatment, where we were looking at things like, what is post-acute withdrawal syndrome? What are the symptoms? What do you need to look out for? What is addiction? How does it work? How does it recur? What happens if it does recur? What do you need to be doing to maintain your own health, your family's health? And how do you incorporate all of this into a life where you've got demands to go out, make a living, all of these other things? So that level of education is critical. And the further I go in my recovery, the more and more important I feel like it is. And that's why I continue to read and try to learn more about recovery and about addiction in general, because I feel like the more I learn, the better off I'm going to be in the long run. The fourth step is to know your warning signs. So the authors say every person has a unique set of personal warning signs that indicate that the process of recurrence is occurring. Problems may be situations outside of yourself or within. Symptoms may be health problems, thinking problems, emotional problems, memory problems, or problems with judgment and appropriate behavior. Know your warning signs. I know for a fact that one of my warning signs that I am headed back to addictive thinking is I start to feel like a victim. And whenever I start to feel like a victim, that's a good sign that I'm not doing something right. And I need to look at what I'm doing on a day-to-day basis and figure out where I need to make some changes in order to get back on track. It's those kinds of things that we need to learn to see in ourselves in order to address them before they get out of control. So that goes into number 5, which is warning sign management. So if we see a warning sign coming, what do we do about it? How do we react to it? And what do we change in order to address it? And the whole purpose is that we're not going to become better by going to treatment. That's an important step for many of us. But we become better by practicing every single day. That's the work that people talk about in many recovery programs. We practice every single day, and we develop new habits. So the authors say here, it is essential for you to establish new responses to the identified warning signs of relapse. Determine what you are going to do when you recognize that a specific warning sign is working in your life. Practice each new response until it becomes a habit. If the new response is to be available to you in times of high stress, you must practice it in times of low stress. So we practice, we develop those habits, and by developing those habits, we have a better chance of coping with the warning signs when they come up than we do otherwise. Next step, inventory. Inventory in the morning and inventory at night. When I was in treatment, we did this. Every morning we got up and did an inventory of how we felt about that day, what goals we had that day, anything, any physical ailments, any emotional feelings we were feeling, and just did a self-assessment. Every night we did the same thing, looking back on the day. Is there anything I could have done different? How did I help people? Those are the kinds of things that we need to do. And the authors here advise people in the morning to clear out 5 or 10 minutes to read the daily entry in the 24 hours a day book and briefly outline your plans for the day. Ask yourself if you are prepared for the day and what you can do to help you what you can do that will help you physically and emotionally meet the challenges of the day and maintain comfortable sobriety. The end of the day inventory, AA step 10, although I've heard people say the inventory is really step 11. I don't read both of them. They both have great things to say about self-analysis, how to conduct yourself through the day, and then how at the end of the day to look back on what you've done during the day. So that's an important thing to do at the end of every day. And then just like we do a daily assessment on step 7 here, we do a review of our entire recovery program. So if something's not going right, or if at the end of each day we are feeling the same thing, or we're having trouble in the same places, maybe it's time to review our recovery program. Look at your recovery program, see how it can be used. And I put a star next to this line. You must learn to challenge yourself in your day-to-day living. So very important. We don't want to stagnate. We want to be challenged. We want to continue moving forward and continue getting better and better. And that's how we stay strong in our recovery program. Next, we involve significant others. So you cannot recover in isolation. That's a very, very important part of any recovery program is the fellowship of not only your friends and family in recovery, but your family outside of recovery. So very important to involve those people. And then finally, follow up and reinforcement. So addiction does not go away. It is a lifelong chronic disease. Recovery from addiction is a way of life. Look, you do not go to treatment and stop drinking and then do recovery work for a few months and then feel better and stop doing that recovery work. It doesn't work. And what happens is that you may be able to continue on for years. After that, you may be able to stop doing anything related with recovery and go on for years. But what I've heard time and time again from people who have done that is that eventually they find themselves back, right back where they started, drinking or using drugs again. And the people that I've talked to about this have always lamented that if they had just continued to do the work, they might have had a chance at not having that recurrence to addictive drinking or to drug use. So it's very important to remember we have to make these plans to incorporate this into part of our daily life. It's something that has to happen every day, something we've got to do and work toward every day so that we have lifelong, comfortable, and peaceful living in sobriety rather than a daily struggle to keep away from drugs and alcohol. Tomorrow we'll talk about the family in relapse or recurrence syndrome and discuss some of the different things that can often be problematic with dealing with the family, especially if you've got a lot of wreckage of the past, as we say in AA. I hope to see you then, and I hope you have a great day today.